So someone wanted to know about the Pontine syndromes, Foville syndrome versus Millard Gubler. And I'm not sure that these acronyms actually help us, but I think it's useful to understand what the pons looks like and how that could come to neuro-ophthalmology. So in the pons, we've got the dorsal pons and we got the ventral pons. And so in the dorsal portion of the pons is where all the eye stuff lives. So the final common pathway for horizontal gaze is the parapontine reticular formation and the cranial nerve number 6 nucleus. The cranial nerve number 6 nucleus and the parapontine reticular formation are involved in horizontal gaze. Horizontal. The vertical gaze centers live in the midbrain. And so the cranial nerve 6 has to send the signal across and up rostrally to the midbrain to the cranial nerve 3 subnucleus via the medial longitudinal fasciculus. And therefore, if you ding out the horizontal gaze centers, cranial nerve 6 or PPRF, you'll get a horizontal gaze palsy because you are disrupting the ipsilateral input to the lateral rectus muscle and the contralateral input to via the medial longitudinal fasciculus to the medial rectus in the subnucleus of 3 on the other side. And so when we have a dorsal pontine lesion from the cranial nerve 6 nucleus, then you can get a horizontal gaze palsy. And because the fascicle of the 7 wraps around the 6 nerve nucleus, the combination of a 7 plus a horizontal gaze palsy is going to occur in dorsal pontine lesion because it's so close together. And if that lesion extends further ventrally, you can knock out other important structures in the pons. And if it extends all the way to the cortical spinal tract, then you'll get a contralateral hemiplegia. So a contralateral hemiplegia plus an ipsilateral 7 plus an ipsilateral 6 nerve nucleus causing a horizontal gaze palsy, Foville. However, if you just put the lesion a little more ventral and spare the nucleus of 6, then you don't get the horizontal gaze palsy. You just get the cranial nerve 6 fascicle, the cranial nerve 7 fascicle, which are ipsilateral, and the cortical spinal tract producing the contralateral hemiplegia. And some people call that Millard Gubler.